Welcome to Exercise Science 4160. Today we're diving into the fundamentals of rehabilitation, what it is, why it matters, and the principles that guide effective patient recovery. Let's start with a fundamental question. What exactly is rehabilitation? Ultimately, rehabilitation is restoring the human body to optimal function. Here's what we'll cover today: the definition and goals of rehabilitation, core principles, program components, and its broader role in healthcare. Let's begin with the basics of what rehabilitation means in clinical practice. Rehabilitation is a treatment designed to facilitate recovery from injury, illness, or disease to as normal a condition as possible. Notice how different professions view this differently. Physical therapists focus on movement. Occupational therapists emphasize daily living activities. Athletic trainers center on returning athletes to sport safely. The key goals of rehabilitation include restoring function, reducing pain, preventing further injury, and ultimately returning patients to their desired level of activity. Now let's explore the foundational principles that guide all rehabilitation programs. Every rehabilitation program must be patient-centered. This means conducting a comprehensive assessment, understanding each patient's unique needs, and setting realistic, measurable, and time-bound goals specific to them. Effective rehabilitation requires collaboration. PTs, OTs, ATCs, physicians, chiropractors all bring unique expertise. Think about how their roles differ and where they overlap. We must base our treatments on the best available evidence. This means combining research findings with clinical expertise and committing to continuing education throughout your career. Teaching patients to manage their own condition is crucial. Home exercise programs give patients the tools to continue recovery outside the clinic. This is where real progress often happens. Let's break down the specific components that make up a comprehensive rehabilitation program. This image illustrates the various components we'll discuss. Notice how they build upon each other. We distinguish between therapeutic modalities and therapeutic exercise, then progress through phases. The acute phase focuses on protection, controlling inflammation, and pain management. We start with static muscle contractions, joint activation, correcting faulty mechanics, and static proprioception. The recovery phase advances to flexibility, range of motion, dynamic strength and endurance, aerobic conditioning, dynamic proprioception, and activities of daily living. Finally, the functional phase includes sport-specific training and injury prevention. Now let's look at the principles that guide how we progress patients through rehabilitation. The following lists those principles that guide our rehabilitation efforts. Progression follows a pyramid structure. Patients can't perform advanced agility drills before achieving adequate flexibility and strength. Exercise progression moves from isometrics to isotonics to isokinetics to plyometrics based on patient goals. Let's zoom out and examine rehabilitation's broader role in the healthcare system. Rehabilitation looks different at every age. Pediatric rehab addresses developmental delays and congenital conditions. Adult rehab manages chronic conditions and post-surgical recovery. Geriatric rehab focuses on age-related changes, fall prevention, and maintaining independence. Rehabilitation occurs in many different environments, from hospitals to outpatient clinics to patients' homes. Finally, rehabilitation is vital to public health. It reduces disability, enhances quality of life by helping patients engage in meaningful activities, and has significant economic impact by preventing complications and re injury.